Okay, everyone. Good evening. I'm just going to load my slides. Yep, hopefully everyone can see that. Hi, everyone. Thanks for tuning into my Facebook Live tonight. My name is Khanh Nguyen, for those of you who haven't seen me here before, and I am a community pharmacist. I worked in the industry just in pharmacy for about 15 or 16 years now. And for any new listeners tonight, I joined Glaucoma Australia's pharmacy committee back in June of 2020, and I've presented a few of these Facebook Live sessions. So last year I spoke about COVID vaccinations, and I also spoke about how to access medicines during lockdown and restrictions. I'm still really enjoying the collaborative work that I get to do with GA and to deliver educational sessions such as these to the public and to the wider community. So I firstly would like to begin by acknowledging the traditional custodians of the land on where I'm coming from today, being the Turrbal country in Brisbane, Queensland. And I would also like to pay my respects to elders past, present and emerging. I also want to extend my thoughts to anyone in Queensland regions who were hard hit by some of the wet weather recently. I hope everyone is keeping safe, well and dry. And I know that this week also marks National Volunteer Week. So I also wanted to acknowledge all my GA colleagues who give up their valuable time and expertise to support this amazing organisation. So some of you may know that my background has been predominantly in community pharmacy. And I currently work in the pharmacy education space. And my slides tonight, I'll be talking about do's and don'ts of using your eye drops. The other thing is I'll be comparing generic and original brands, and also give you some general tips for using your eye drops. And also while I'm here, I'll give you some current updates of what is going on in community pharmacy. There's been a lot going on in the media at the moment, particularly because we have an upcoming election this weekend. All of these changes are positive in my own opinion. So I hope that you enjoy the discussion. I like to keep everything very informal. So please send through any questions at the end and I'll do my best to answer them. So a regular scenario that I'll see in the pharmacy is that a patient will drop off their eye drop prescriptions to be dispensed each month. If you don't know your pharmacist, I do encourage you to introduce yourself to them. I like to think that we are friendly and approachable people. And I know personally, I always like to know my patients on a first name basis. So obviously, if you don't know them, try and introduce yourself. It's always nice to sort of build that rapport. So the first thing is, do check the expiry dates of your eye drops. And when you purchase your eye drops, so long as the seal is not broken on the bottle, the shelf life is usually printed on the box or on the bottle itself. But once you break the seal or you open the packaging, most of the eye drops will only last for 28 days. So it should be noted that sometimes your pharmacist will put on the discard date on the dispensing label, and it will read discard 28 days after opening. So you should actually strictly follow these directions. Some eye drops have a longer shelf life once they've been opened, particularly things like lubricants. I've seen some that last 3 months or even up to 6 months due to the use of a preservative. But please don't ever use your eye drops past the expiry date, because once it's past this date, you can increase the risk of getting an eye infection, and the medication can also lose its efficacy after this time because it's not meant to last longer than this amount of time once they're opened. The other thing is, I do recommend that you set a reminder on your calendar or some sort of alert. Some pharmacies also have a medication management app or an SMS reminder service. So please use anything that you can to remind yourself to always use your drops at the same time every day. The other thing is, you should also check the validity of your eye drop prescriptions. Your prescriptions will legally be valid for about 12 months from the date that they are originally prescribed. However, it is important to note that if an eye drop has only been prescribed for about a month, as your prescriber has noted, the pharmacist may want to check with the doctor to make sure it is okay to continue using it. So for this reason, don't miss appointments with your ophthalmologist or optometrist or your doctor. It's important to be reviewed regularly. So any 6 months is usually a good time, or as advised otherwise. Keep a diary of your symptoms. I always encourage keeping some sort of log about anything, small or large changes you experience, because it's always going to be helpful for your ophthalmologist and your optometrist to know about these, and to maximise, the opportunity to talk about anything that you might have experienced. Do also check the storage requirements of your eye drops. Sometimes they may be refrigerated at the pharmacy, but once they leave the pharmacy, you can store them in a cool, dry area outside of the fridge. The other reason you don't need to store them in the fridge is because if your eye drops are too cold, they can sometimes sting and irritate your eyes. And this is because your eyes, and obviously your body, generally prefers things to be as close as possible to our body temperature. So I always encourage that if you're going to store drops in the fridge, because that's what the storage requirements are, remove them for a few minutes, just have them sit on the bench, and then use them, and you're going to have a much more comfortable experience. If you happen to be travelling, GA also have a few storage options on their website in the forms of a cooling pouch, so that you don't have to worry about storage while you're away. And if you accidentally miss any doses, you're away on holidays, you're out of routine, or you simply forget, don't double up on your eye drops. When you remember to use them next, just instill them as prescribed, and don't worry about the missed dose. You should also never use more than the prescribed dose, and the occasional missed dose is unlikely to be harmful, but if you're missing regular doses, it would be a good idea to use some sort of reminder, put some alarm in place, so that you are more likely to use them every day. So before you use your eye drops, do also wash and dry your hands thoroughly. We're also, remember, living in pandemic times, so whenever handling any medication, it's always a good idea to use aseptic technique. I don't advise using hand sanitizer beforehand, because if you accidentally rub your eyes, it may sting and also cause some other issues. Often our eyes are more sensitive, so I think just your traditional, like soap and water is going to do a better job. Also, take care with the tip of the eye drop bottle and try not to contaminate it. So we want to aim the bottle towards the eye, but not actually touch the eye itself or any other surface, to avoid any cross-contamination. Always wash and dry your hands after using or handling medications. And if you don't have a steady hand, it's obviously okay to use somebody else in your household, but make sure they are also doing the right thing and washing and drying their hands. So I know this is a bit of a busy slide, but I think the picture probably says enough. It's just a bit of a refresher on how to actually instill your eye drops. So firstly, as the picture suggests, tilt your head slightly back and look upwards. Then with the other hand, pull your lower eyelid down so that you can actually make a pocket for the eye drops to be inserted. And with the other hand, hold the eye drop bottle carefully upside down and gently squeeze the bottle to release a drop. Only obviously squeeze one drop at a time, and squeeze the number of prescribed drops into the pocket only. After instilling your drops, close your eyes gently and using your index finger, press against the corner of your eyes towards the nose so that the medication has time to absorb. The other thing is, if you happen to be a contact lens wearer, so I'm also a contact lens wearer some days, it's always remove your lenses before you insert any eye drops, and then wait for about 15 minutes before you insert them again. The only time you can wear your contact lenses for drops is if you're using a lubricant to refresh your dry eye, but otherwise all drops should be removed. So you also are able to order an eye drop dispenser aid directly from the GA website. If you're unsure of which one to order, speak to one of our lovely clinical educators who will advise depending on which drop you use. There's obviously quite a few available, so I know sometimes if you don't know, and it does depend on the company and also the type of bottle. And just some other tips for using your drops. If you happen to use multiple eye drops, and this is not unusual for someone who has glaucoma, whether it be on prescription, you purchase over-the-counter drops like lubricants, allergy eye drops, that sort of thing, do separate them for about 3 to 5 minutes. Your ophthalmologist or eye prescriber might inform you of the amount of time that you should wait. I know I've heard different opinions, and it's always good to get their advice on that. You're more likely to get positive outcomes when you are compliant with your medications, and you can also ask your pharmacist if you have any questions about your medicines, and you may even be eligible for a meds check. So that's actually a medication review, which is a subsidised review to discuss your medications in the pharmacy. Sometimes you might even be asked at the pharmacy if you would like a generic brand. So you might not be sure whether the generic brand of your drops will do the same as the original brand, and this is not an unusual thought. So I'm just going to show you just a little bit of information about what the difference between a generic and an original brand is. So the generic brand is usually known as the drug name or the active ingredient that is in it. It's usually had bioequivalence tests done in order to show that it's bioequivalent or the same as, has the same effect as the original brand. Brands can also be interchanged without differences in clinical effect, and usually the packaging, the shape, size, colour of the bottle, that sort of thing is probably going to be a little bit different. And with the original brand, usually you'll know this as the branded name that is marketed by the pharmaceutical company. And then there is a patent usually on this brand to protect for several years. And this allows the original company who produced it to recuperate any costs and obviously money spent on the research and development into going into the medication itself. Okay, so if so at the moment, your original brands are usually a little bit more expensive than your generic brands, and the generics are there to obviously save you some money. And everyone should know, obviously, there's an election coming up, and there have been various national campaigns to make medicines more affordable to the general public, particularly for those paying general prices. And I know there's a few glaucoma eye drops that fall into this category. So the copayment, which is the amount out of pocket paid by you as the patient, is currently for a general patient about $42.50. So for a concessional patient, it's $6.80. And these amounts or copayments usually apply to medications that are listed on the Pharmaceutical Benefits Scheme, or what we know as the PBS. So there has been a new pledged copayment amount that the government have actually been, pledging to the general community, and it will actually depend on the election outcome. But they are sort of saying that the general payment will come down to as low as $32.50, and the concessional patient will pay $6.80. But this is quite, I think a lot of money that you can save. So if anything does come of this, then it won't actually take place until January of next year. So watch this space. The other thing that I will note is that from the 1st of July, so that's only really a few weeks away, the safety net threshold will also be reduced. So at the moment, if you don't know what the safety net is, it is the threshold that needs to be reached in terms of the amount that you pay for your medications in order for you to get your medicines either at a less, pay less money for them, basically per prescription, or you might actually have them fully subsidised, depending on whether you hold a general or a concession status, okay? So at the moment, for a general patient, this can be per family, couple, it's at $1,542.10, and the concession patient is $326.40. If you don't know about the safety net, it's not a bad thing. It usually probably means that you're healthy, you don't ever reach it. The safety net was put into place to assist those that are on a lot of medications, have chronic conditions, and to also help subsidise families that have quite a few family members on multiple medicines. So if you don't know about it, you may not ever know about it. But on the 1st of July, the safety net threshold is going to be reduced. So the general patient will have it reduced by 2 fully priced general scripts. So that's what I said before was the $42.50. And then the concessional patient will have it reduced by 12 fully priced concessional scripts. So that's quite significant, I think. And obviously the amount has been reduced in order to make Australians just be able to obtain fully subsidised medicines or at least pay cheaper prices for PBS medication. So if you normally reach the safety net at a particular time, you may even find that you'll reach it sooner. And this might not necessarily be that you're sicker, it's just because that threshold has been reduced. Okay, so the last topic I wanted to discuss tonight is about getting vaccinated against influenza. So most of the population are now triple vaxxed for COVID, which is really great to see. And because the international and state borders are now open and we have the freedom to travel again, viruses also are going to be travelling around, so viruses such as influenza. So it's highly recommended that the community is vaccinated against the flu. If you're planning to receive a winter COVID booster shot this year, so you can be eligible for that about 4 months after the most recent COVID dose if you are triple vaxxed. And ATAGI have now approved for both vaccinations to be given at the same time. So you can actually go to the pharmacy, book in for a flu vaccination and a COVID winter booster vaccine, so long as you are due for it. And you can protect yourself this winter. So you try and book in as soon as possible. And your pharmacist might charge a vaccination service fee and ask you to stay behind in the pharmacy for about 15 minutes after you get the injection so that they can observe for any reactions. That concludes my talk tonight, but I'll open it up to any questions. I can see that a few have come through. After this session, if you have any other questions, please see your local pharmacist. You know, you can contact GA or you can actually, obviously ask the next time you see one of your prescribers. But I'm just going to go through the questions now. Just bear with me a minute. Okay. So one of the questions I can see here, so there's quite a few that have come through the chat, so I might even start there. Is my pharmacist able to advise me if herbal and homeopathic medicines can affect my eye pressure? Okay, so this is a good question. So a lot of pharmacists are trained usually in obviously pharmacy medicines. Some will also know about herbal and homeopathic medicines. I know personally I do come from an integrative background where I used to use herbal and pharmacy medicines in my practice. But certainly, if you're planning to use anything, so off the top of my head, the things that you would maybe use for eye health might be things like lutein, vitamin A. There's quite a few things, but having said that, it's always a good idea to make sure that I think it's always respectful as well to include the opinion of your ophthalmologist or your eye prescriber, for that matter. They can give you some advice, but I think that it's always good because your prescriber is the one that's looking after your eye health to include their opinion as well. Okay, so there's some things that are evidence-based. So I know, for instance, fish oil, there have been studies for dry eye to use fish oil, but then fish oil is not appropriate for everybody because if you are on a blood thinner, it can also affect the blood thinning medication. So you also have to make sure that it's safe with anything that you are currently prescribed as well by your doctor or your ophthalmologist. Okay, Safluturn eye drops are currently out of stock in Australia. Are these issues usually expected in the long term? This is a really good question, and I know that during lockdown and restrictions in 2020 and even 2021, this actually did occur for a lot of reasons. So due to ingredient shortages, packaging shortages, lack of people in the factories that make them and manufacture them, there's lots of different factors involved. So what I normally suggest is always try and have at least 1 week's supply left. So if you know that you've got to replenish your eye drops within a week, that's why we should mark it on a calendar of some sort. Make sure you use that week ahead to source another supply so that you've got a fresh bottle. The other thing is if you've got supply issues, it gives you a chance to, try a few different pharmacies. If they are unable to assist, then you've got time to actually reach out to your ophthalmologist or your GP, and they can also sometimes prescribe something else, and that's obviously not ideal. But in the short term, if that's the best solution and they're going to assess that for you, then that might be the best way to manage that. So with the Safluturn eye drops, sometimes your pharmacist, like I know that I've done this before, they might ring the supplier directly and just find out how long it's going to be out of production for so that we have an idea, you have an idea, and then you can actually plan around this and make some, book some appointments and, make some decisions otherwise. So the next question is from Erica, who's been newly diagnosed xylitol, perhaps it's xylitol. How will it change my blue eye colour? Oh, this is a really good question. So traditionally, all eye drops will actually have side effects. Okay, so most of the glaucoma ones, though, not all of them, but most of them, I know xylitol is one of them. One of the more side effects that people actually do like is that it can actually make your lashes longer and your eyelashes longer and also more prominent, and it's often used for cosmetic reasons as well. But with your eye colour changing, it can be a factor. However, it takes place for a long, it doesn't actually happen for a long time. So usually, I guess if there's any risk, and the risk is only very small, then it won't actually happen. And normally, you'll actually be able to see the differences, and your ophthalmologist as well will give you the risks and the benefits. Your pharmacist can also advise otherwise. But there have been some cases, I wouldn't be able to give you a statistic, but of some cases of some instances where some glaucoma drops have caused changes in your eye colour. So So should I use my glaucoma eye drops as usual on the day I get my flu or COVID vaccination? The answer to this is yes, I believe that you should. Everything that you take when you have your flu and your COVID vaccination, either or even both, should just be taken as usual. Your glaucoma eye drops, I have mentioned this before in one of my talks, that if you are starting your eye drops, your glaucoma eye drops, it's probably a good idea to wait until after you've had your flu or COVID shot, because if there's been any reaction, it's good to know whether, if you space them away, which one caused it. So if you have glaucoma eye drops as a regular part of your routine and you've been stable on them for a long time, yes, you can still use your eye drops on the day when you're getting vaccinated. There's a question from Paola. What if I accidentally put in 2 drops? Paola, this is probably not the first time somebody has asked a question like this. So it's quite easy to do, because if you accidentally squeeze the bottle too hard, sometimes it does release a really large drop or 2 drops and you can't control it in time. So often, if this happens just every so often, it on the odd occasion, it's not going to harm you, particularly if it's a glaucoma drop. If you obviously, if you keep having this happen because you can't manage the bottle, use one of those eye drop dispensers just to assist. But yeah, it isn't going to cause any long-term harm if you accidentally do 2 drops. Question from Charmaine. I am allergic to glaucoma medications. Are there any new drops coming out? Oh, Charmaine, sorry to hear that. So with your glaucoma medications, I would say that if you've tried a few different ones and you've been allergic to all of them, it could possibly be even the preservative that you're allergic to. I know that if you try different brands, often changing to a different brand might help, or it possibly could just be because you've got sensitive eyes. There's always new drops coming on the market, and I know anything on the PBS is always going to be, obviously in Australia, we have things approved by the Therapeutic Goods Administration, the TGA, and anything that comes through is usually evidence-based, has a lot of research behind it. The drug companies have done lots of studies, so usually there'll be other options. Otherwise, I would suggest that you just get your eyes tested regularly and getting regular reviews with an ophthalmologist. And unfortunately, it's just going to have to be a bit of trial and error until you actually find one that suits you. And sometimes what happens is it's about managing the risks and the benefits. So you might actually get some sort of a milder reaction with some drops than others, and it might be best to stick with that. But I think your ophthalmologist is going to be the best person to assess that overall. Question from Helena. Does glucosamine increase pressure in the eye? This question, glucosamine, I personally have not seen this in my practice or know about it. Certainly there's a lot of information on the internet, and we don't want to believe everything that you come across. It could be misinformation as well. I think that sometimes it is best because information on the internet, to use reputable sources. So make sure you're also using resources that also come from Australia, because that's the medicines that we actually have access to. But I haven't actually read anything recently, just in practice. But this might be something that one of the clinical educators could look into from GA if you're concerned. And then the other thing is, a lot of the time, someone who's on glucosamine probably has a lot of other conditions going on, so could possibly be related to one of the other conditions. Question from Mark, does vitamin B3 help with nerve protection? Mark, just wondering whether you mean nerve protection generally, or is it to do with your eyes? So B3, yeah, so I think that we might, I might just need a little bit of clarification before I answer more of that. Optic nerve. Okay, so the optic nerve, yeah, I actually haven't read any evidence-based information about B3 helping with optic nerve protection. Sorry, I won't be able to answer that tonight. If that is something, it's probably recent. Okay, I think that that's all I actually have time for tonight, everybody. So thank you so much for coming and listening. I hope you've learned something new tonight. But certainly, there's a lot of new research in glaucoma. Make sure you've signed up to the email with GA as well, so that you're up to date with what's going on in that space. And I hope that everybody has a lovely rest of the evening. Take care.